So we've really been lucky to be working, and Rebecca and I have been working pretty closely along with all of our member pools, not just for the past several years, but in particular in the past 10 to 14 days. We've been having lots of conversations back and forth about this conference call, this meeting and information, but also all of the preparation for it. And so as we get going today, you know, Rebecca knows our community. She understands pools, she understands local government entities and all the issues we face. So we're very, very lucky to have her helping us facilitate these conversations and sharing with us her perspective that's going to be so valuable. Part of the reason we wanted to have this call today, when there are so many shifting elements and there are so many massive just unknowns and components that we're still struggling with. Really, there are three things that I'm hoping we can accomplish today with all of you. Number one, we wanted to just be able to provide a solid planning process. Again, we have so many unknowns, we have so many shifting landscapes, we have so many pieces of this puzzle that have yet to come together. So what we're hoping to do today is just provide some strategies, some methodologies, some thought processes that are going to help you ground yourself in a methodical way to think about things and look at things and make sense of all of the different disparate pieces of information that are coming in the door. The second reason that I think this morning is so incredibly important is to just help us all sort of take a deep breath and slow down a little bit. And I know that sounds a little ridiculous when your phone is ringing off the hook, you've got members calling you with questions, you've got legislative proposals coming in the door every single day, you've got this barrage of issues that you need to deal with. Maybe you've got your reinsurance renewal coming up and you're trying to figure out what that looks like. So that message to slow down, I realize can be very, very difficult. But the reason that that's so important, and the reason that I wanted to just mention it at the get-go this morning, is that opportunity to slow down, to really think about how we're thinking about this issue is going to be critical for all of us in the coming 6, 9, 12 months. It's going to be critical for public entities. It's going to be critical for pools. We're going to have to take a few minutes to just break away from sort of looking at that sidewalk that we're marching down and raise our eyes up to the horizon and to think about what this issue, what this set of issues really looks like a year from now. I think there are absolutely, and we'll hit on them today, some short-term issues, right? We're looking at some liquidity issues. We're looking at how we can keep the money in the hands of our members as much as possible because they are needing it for their frontline response. But we also know that this crisis is going to test the long-term elasticity of local public entities. And therefore, it's going to test the long-term elasticity of public entity pools. And so being able to look at what's the immediate need versus what's the long-term need and making sure that we've got that method and that time to be thinking about those questions is so incredibly important. So I will tell you that, in fact, I just recounted this morning, since March 9th, we at AGRiP have talked to 58 pools. So in the last 3 weeks, we have connected with at least 58 of you, talking through your issues and hearing what's going on and hearing about all of the different decisions that you are facing. Everything that Rebecca is going to talk about today and we're going to share today is going to come out of those conversations. I tell you that because no matter what it is that you're facing in your pool, I guarantee you that there's at least 2 or 3 of your colleagues who are dealing with exactly the same thing. The ripple effects are going to be pretty huge. But absolutely, not only will we continue to share the information, but we're here to help you make sense of what you're dealing with in your own pool. So if I haven't talked to you yet, if you're not one of the 58, chances are good we're going to connect sometime in the next couple of weeks, and we'll keep working through this together. So Rebecca, why don't you go ahead and let's get started.
Thanks, Anne. And hello, everybody. I want to just start by giving you guys some context. You know, Anne has talked to 58 pools, and we also, our team, because we work so much with local government and quasi-public sector, it's pretty incredible how the, how the sense making is happening. So we've got situations where everyone's just trying to make sense of things. What is going on because the conditions are changing so rapidly. And you are so fortunate at AGRiP to have an executive director who can both think very tactically about the sidewalk, as she just alluded to, but who also has her eyes to the horizon and is trying to do some looking forward, not just to be of help to you as members, but to be of help to your members, you know, your end users. So FYI, if you do not yet have your laptop or your iPad on mute, we can hear everything that's happening. So please go ahead, take a moment and put your iPad or your laptop on mute. Thank you. So I was the resident futurist at AGRiP for a couple of years, and so this concept of foresight is not new to many of you, but you may need a refresher. So we're going to start by just level setting. How do we start to plan for the future of COVID, or even beyond COVID, when we're so swept up in this moment right now? And there's a process that we use, as futurists to help people think all the way around an issue. So it starts with the first step of framing the domain. You know, what do you want to explore by when? So what Anne did last week is she convened a series of pool leaders, and we looked at the future of our members over the next 6 months and the future of pools over the next 9 months to try to think through what that could look like. So we started by framing the domain, but then we skipped to step 3. We started to think through some plausible forecasts. And there are certain times when skipping step 2 makes sense, and emergencies or massive disruptions are one of those times. There's a person who is SCHOW. Could you please mute yourself? I'm not able to mute you from my end. Thank you. Thank you. Okay, so what are scenarios? We're going to jump to step 3. What are scenarios? Just again to reground you. Scenarios are stories about what could happen in the future, right? That's all they are, is plausible stories. And they allow us to imagine things that could happen so that we can start to rehearse our own responses to them. And, you know, the reason scenarios are very useful right now in this moment is that you came into 2020 with a strategy. In fact, you may have a strategy that starts on April 1st, or a strategy that starts July 1st or October 1st, whenever renewals occur, right? You have these strategies that you had already rehearsed, but when you move into a disruption, you've got to test those strategies around the new reality. The easiest example is in-person meetings, right? Because of physical distancing, I don't like calling it social distancing, because socially I think we need to remain connected, but physically we are trying to distance. But in light of a new reality, people can't meet, so you can't go out on calls with your members. And certainly if you were going to have a meeting this spring, you've rethought that. How can you either do it virtually, or when do you postpone it? So rehearsing these possible futures allows you to say, which of my strategies still works and which doesn't? Then you can update new ones. You can think through new ones. The third thing here around why scenarios are useful is because, as Anne said, they allow you to slow down. And I want to reinforce for just a moment how important it is for you to slow down. It's not just because if you slow down, you can take wiser action. It's also because the way you show up is itself an emotional contagion. So when you're frantic, you make your staffs frantic. This is absolutely true. Scientifically, we know that people's emotional states are contagious. We know that if one person in your household is depressed, it's far more likely for other people in your household to become depressed. So we as leaders need to slow down, think things through, make sense of what's going on so that we can be a calm presence for the people around us. And then finally, the reason that these scenarios are useful is because they can get us out of the, oh, poor me, the future is happening to me, and they can move us into, okay, let's imagine what could happen so that we can be ready to snap into action. And you guys certainly know how to do that, right? Okay, so there are several sense-making questions. I talk a lot right now about sense-making because anytime you're facing like a big disruption, you're all familiar with the COVID curve, right? Or the apex of when we're expecting, you know, the most medical treatment within our communities. I think every community, every public health official is showing these curves and how to flatten the curve and whether our curve is flattening. You know what this curve looks like. Well, when we're on the pre-peak of that curve, that's when we need to make sense. We need to start doing some sense making, because once we hit the peak, very few people are going to be paying attention, because we're going to know somebody in the hospital. We're going to be in the hospital ourselves. We're going to be trying to backfill for our own workers who are missing because they're sick, they're not feeling well. So these sense-making questions, the 5 that we have here, are the ones that we're going to step through today so that we can be better prepared on the backside of this. So what do we know? What don't we know? These are the first 2. What are the plausible futures? What can we do to improve our future zone? We're going to get to that in a moment. And then finally, what can we expect of these tripwires that are going to move us from plan A to plan B, or from scenario 1 to scenario 2, okay? So these are the questions, the structure that we're going to follow for our time together today. I'm a big believer in moments of disruption that you need to keep 2 lists. What do we know? What don't we know? And in this rapidly changing environment, things are coming off your what don't we know list and being moved on to what we do know very rapidly. Just in the 2 weeks since Ann and I have been working together, there's a lot that's moved from column B, what we don't know, to column A, what we do know. Here are some of the things that we know right now. And these are things that we've both crowdsourced from our think tank of pool leaders over the last week, and also things that you know, Ann has gained from the intelligence, the AGRiP intelligence feelers, sense makers out in the world, and from some of you, right? So what you know right now, what you know in your pool are renewal dates. You know your operating and admin budget. You know the population within your pool of emergency workers who are covered, right? Because this is something we have to start to anticipate. Your net position, how much you currently rely on investments. You do know the general shape of the pandemic, although that is changing day to day. At the beginning of this week here in the state of Wisconsin, for example, the beginning of this week, the estimate was that May 24th would be our apex. And when I checked yesterday morning, it was April 22nd. So just in a week's time, the apex is scheduled to be 1 month earlier than we thought it was. So that's something that is knowable. We can keep our eyes on that. And we know further that there is absolutely a link between a pandemic and an economic recession. So what else do we know? So I'd like to ask you guys, use your chat function. What else do we know? This isn't a guess. These are things that you know. What do you know right now? Go ahead and put it in the chat. What do you know? What is on your know list? I'm looking over here because this is where my chat window is. What do you know? Sales tax revenue to local public entities will decline. Absolutely. If you live in Texas, every city in Texas, 30% of their budgets are from sales tax. So we know that with a decrease in consumption, there's a decrease in sales tax. We know that most non-essential member employees are working remotely. Absolutely. From Jim Heckman, we know that there are staffing issues. From P. Janis, we know that rent revenue is going to drop. Jennifer Hoff, we're going to have increased absenteeism. Absolutely. We know that this is true. All emergency first responders are being told that they have a 100% chance of getting COVID, that the likelihood is far greater for them. In Indiana, Gary Malone says, we know that property tax collections will be delayed and income tax declines will follow. So there are going to be lags in our budget. FOIA and open meetings issues are starting to come into view, right? Because what happens when we start having meetings online? How do those FOIA requests, how do those meetings happen? How do we track those meetings? We know that most local governments who've been through economic recessions before, they constrain their services. Thank you. Jonathan Hall says, our state has frozen state financial assistance to municipalities. Janet Selby says, public pension plan funding levels are going to decline, and that means they're going to need even more funding from schools. M. Harrison says, everyone is impacted. Troy Winslow says, we're going to get lawsuits on various issues. M. Bechamps says, will temporary hospitals be covered? That's probably in the don't know list, and let's go there next, okay? Keep populating the chat with what we know, but now let's talk about what we don't know, right? As we think about shifting from the known to the unknown list, here's why this is important, right? Here's why it's important to track what we know and what we don't know. When we create our know and don't know list, it removes fear, right? Fear has everything to do with worry, right? With anticipating something bad happening. This is how our hardware is wired. We are wired to take care, to take caution. And with everything, kind of all the cards in the deck thrown up in the air right now, it is very natural to be fearful. But when you make your know and your don't know lists, it helps ground you in the present. It brings you to this moment, to this reality, and can take you out of fear. And therefore, your decision-making can be better. So science tells us that when we're afraid, we tend to get very tunnel vision and very paranoid, very sensitive to every, little movement. But when we widen our lens, it can help bring down sort of the, the blood pressure in the room. It can help us see things in a different way, maybe in a new way. We also know that there's a coping curve to this. We know that people start out by being very fearful. They deny that it's happening, right? So certainly we saw that, spring breakers saying, this can't happen to me, right? And now we see more and more fear, especially as apexes are created in communities, as new legislation is coming out. It can feel like a, fasten your seatbelt. But at some point, when you start managing this in a way that is grounded, that is forward-looking, that is based in fact, not just fear, you start to accept, all right, landscapes are shifting. We are going to shift too. And how are we going to do that? And it can also be peppered with a little bit of appreciation. Not everybody gets to appreciation. And oh, by the way, if you're like, Rebecca, moment by moment, I'm in denial, I'm in appreciation, I'm in acceptance, I'm in fear. Perfectly natural. Welcome to being a human being. That is absolutely going to happen. You can ping pong back and forth between them. But we as leaders of our pools, we as people that others are looking to for insurance, for support, right, as best as we can, to stay in a process, to stay in a mindset that's based on fact, that is trying to anticipate what's coming, that's being responsive, but not being frantic. That's the lane we want to stay in. So let's talk a little bit about what we don't know. Through the think tank, the AGRiP think tank that was convened last week, and again, through the intelligence sensors that AGRiP has out in the field, we don't know the final direct impact to our staff. Some of you have staff who are being hospitalized right now. Talk to many organizations that have had 4 or 5 people who've had COVID already. We don't know how deep the economic impact is going to go. Some of it depends on how long the pandemic lasts. It depends if we're going to have a single humped pandemic or if we're going to have a double humped pandemic. So we don't yet know what the depth of the economic impact will be. We don't know. This legislative environment is changing rapidly, so we don't know what's going to be expected of our pools as legislation changes. We don't know if our current models are going to work, right? Do we have to change our assumptions and rebuild those models? And then how long will that be? Probably building a model for the next 6 months isn't enough. We have to think through the next cycle with our members, right? And how what's happening today is going to impact the very next decision that they have to make and the decision that they have to make the next renewal cycle around. Legislation in courts, how much money will the pool have left by the end of 2020, right? And then this is something that Anne and I and several other people are thinking about very dearly, but the snapback effect, right? There's only so much elasticity in the systems, in the federal system, in the state system, and in our local systems. And we know that at all three of those levels, we've cut. So how much give is in these systems? How much elasticity is in these systems? And when and how do they snap back? Now it's your turn. What else don't you know right now? What don't you know? Please light up the chat. What don't you know? Yes, the compensability of claims, workers' comp claims, since the virus is community spread. I know last week at this time, it was 2 states, North Dakota and Michigan, that said all first responders have to be covered by workers' comp claims.
Several more by now.
Yeah, do you know which ones they are, Anne?
I think Washington has it, Alaska is debating it, Minnesota's debating it. I'm missing at least 2 others right now.
And what do you think is the probability that every state will adopt this legislation?
Every state's going to adopt some level of presumption.
Okay, so
I think the next question is, where does it expand to? Does it stop at first responders? Who else might it apply to?
That's right, that's right. Stephen James says, one thing we don't know is with decreased income, will members have issues paying premium contributions? That could absolutely happen. T. O'Neill says Florida was also included to the presumption as of yesterday. Janet Selby says, how will excess insurance respond regarding coverage? S. Yeager is saying how litigation will work out over business interruption coverage issues. Yes, most common question right now, business interruption. I don't know when schools will come back into session, Katie Fitzer is saying. Patricia Slavin is saying, when will we be able to go back into the office? Tammy Tano, we don't know whether there may be opportunities to attract new members of the kind who heretofore haven't been attracted to pooling. Tammy, are you an attorney? Heretofore? Thrown in the middle of a chat. You must be an attorney. Our competitors' appetites for public entity coverage 6, 12, and 24 months from now. Yes, Jeff, that's right. We know local governments will find innovative ways to respond, but we don't know what those innovative services or approaches will be and how that might impact exposure. Sounds to me like there should be a conversation about how we innovate together. How or when will a vaccine be readily available and who will get it first? Adrian Beatty says, will courts decide if a virus qualifies as a property cause of loss for business income and interruption claims? Carol Wilms, healthcare trend impact, COVID claims plus delayed elective and non-elective procedures. So there's going to be some pent-up demand in the system for those of us who are staying away from hospitals because we're told not to go anywhere near them. Greg Doyon, significant rate adjustments across the board affecting all pools and members. Norm says, will our pool staff see loss of life? That's something I heard Anne ask last week is, what's the impact to your own pool staff around COVID, right? Patricia Slavin, what will be needed to support our agencies in the future? This is a great don't know list. And you guys, there's some relief, I think, that you can feel just getting these 2 lists out and in front of you, right? Because your mind is a good place for thinking about things, but it's a terrible place to store things. And if all you're doing is storing these open questions, you're going to make yourself and everybody else crazy. Get this stuff down on paper, right? What do we know? What don't we know? Revisit the list from time to time, whatever pace makes sense for you. So again, things are changing rapidly. Things are being added to the unknown list and being moved from the unknown to the known list, and frankly, sometimes moving from the known list back to the unknown list, as you know, there sometimes is a little bit of flip-flopping around some things. On a daily, even, you know, I tell this to everybody, one day feels like a week right now with the rate of change that's happening. So getting these lists out in front of you kind of helps you blow the froth off the cappuccino, right? It helps get these things out of your mind onto paper, and to have this discussion even with your staff, because they're sense making as well. They're out and about and thinking about things. So how can you chart your knowns, chart your unknowns, so that you can start to take wise and informed action? So with the knowns and the unknowns done, we now move to step 3 of this process, and that is asking the question, what are our plausible futures, right? What are our plausible futures? And the model that we use was invented by the Institute for Alternative Futures. And it's nice and clean because it's 3 future zones, right? So in blue there, the challenging zone. You might call this the zone of growing desperation, right? Where things just continue to get more and more grim. The second zone is the expectable zone. This is the zone of conventional expectations. So as an example, we've seen big federal government stimulus packages before, for example, after the Great Recession. How does the current stimulus package track against that? And then what could we say about the economy as we track through what we know about previous federal stimulus packages, right? So there are some things that we could kind of process through in that expectable zone. And then in the visionary zone, right? The zone of high aspiration. You know, if the right people were asking the right questions and thinking through this in ways that were really insightful and innovative and imaginative, what could that look like? And we're going to do this together now. We're going to create 3 future zones for our pools. And after we do that, we're going to crosswalk this against some of the intelligence that we gained from our futures panel. So we are going to start with the challenging zone, the zone of growing desperation. Now, before you light up the chat button with your zombie apocalypse worries, I want to encourage you to think about this in sort of two tracks. Things could become more challenging for us, for our members, and for our pools from 2 different stimuli. One is an external stimulus. So a decision that is made for you. The example of the workers' comp coverage for all first responders, that's an excellent example of something that is happening to those of you who cover workman's comp, right? So that's an outside in, an external stimulus. But, right, we can make things worse for ourselves. So what are the things that we might do that would take us into that challenging zone of growing desperation? Okay, so let's frame the domain here. Let's think about the future of our pools through year end. Let's just give it through 12/31. Let's think about the future of our pools through year end. What things, external or internal, could lead us into a zone of growing desperation by year's end? Let's light up the chat and have some therapy, okay? What could lead us into this zone of growing desperation between now and the end of the year? Tracy, thank you, Tracy. Returning premium that ultimately we need to deal with the claims that are not yet known. Yeah, having to make a big payout before you even know what you're responsible for taking care of. Ed says a second Great Depression, a stock market collapse. Reinsurers get even more skittish than they already are, and the reinsurance market starts to feel wobbly, right? Janet Selby, onslaught of claims drains our reserves. Robert Hale, total collapse of medical personnel and facility abilities. Multiple waves of the virus without a vaccine from Jim Hale, Greg Dian, solvency issues, can we remain solvent? Creating an unrealistic expectation of what we as pools can do from James Despelder. Adrian Beatty says, not having staff capacity to deal with mounting member needs. Pools with weak surplus ratios. Jenny Emery says civil unrest. Thank you for starting to introduce some of the social pieces of this, Jenny. I appreciate that. S. Yeager, member relation issues with respect to coverage related to COVID-19 denials. So if you deny someone's claim, that could take us down a growing desperation. A reduction in force across various key pillars in our communities, from Edward Esquivel. Somebody the other day on a different webinar talked about a zone of growing desperation, that our local government officials just think they have the answers, and so they start taking over for staff and making decisions at the local government level. From T. O'Neill to everyone, overall negative response and mindset to member issues. Yeah, people start rolling their eyes like, ugh, members. S. Bub to everyone, retroactive legislative changes impacting claim compensability. Exposure we did not charge a premium for pushing financial risk to the pools. Katie Fitzer says the stay home order continues. Okay. So maybe your blood pressure has gone up a few points, reading what other people are thinking about, but my guess is that you've somehow also been thinking about these things, either aloud with your teams, with Anne, with the AGRiP staff, or just thinking them to yourself, right? It's really important, in my opinion, it's really important when you start working through these possible zones, these plausible zones, to start with this one. The reason is because of what I mentioned earlier. We are wired to worry. We are wired when we're being challenged to be fearful. And if you start in the zone of growing desperation, it allows people to get their worst fears out and processed. So now let's lift our eyes up just a little bit further and tell me what you expect. What is expectable? So what did you do during the last recession? How did you make it through? I know we've never been through a pandemic before, the likes of this one in our pools, so we don't know what to expect there. But how has your pool rallied during other crisis periods? How have your members rallied during other crisis periods? When, you know, an external force has had your community or your members by the neck before, or your pool, what's happened? What's in the zone of conventional expectations? Let's see it in the chat. You can expect some tunnel vision. I think that's true, right? That you just get focused on what needs to be done right now. Thank you. Ann B says, it gave people the opportunity to think in new ways to serve our members. You had to get flexible, right? Okay. Robert Hale says, prolonged hard costs well beyond the life expectancy. So you can expect that some of your non-variables will persist for a moment. Short-term turmoil followed by adaptation, right? That's getting to that curve. It's getting to that curve, Robert. S. Yeager, ability to educate on what we can, can't do, and why. Fantastic. Paul Miola says, member appreciation for our efforts. So there, you will get those pats on the back as you're trying to help your members. Jim Dispelder says, inspiring people to see the big picture and to provide that calming influence. Yes, for those of us who have been through a fire drill like this before, we know what's expected of us. We need to keep the big picture in mind, give people the courage to soldier on. Non-conventional approach to handling insurance or pool issues from T. O'Neill. Carol Wilms says, confirming the 1 in 100-year event actuarial predictions. Right, very good. Adrian Beatty says, ability to use equity to smooth rate increases and financial woes for members if needed and able. So you know that you were able to do some unusual things in the past, you might be able to do them in the future. Kay Walling says, community pulls together, greater empathy. Robert says, we've felt this greater need to interact with members. Edward Escobar, I expect that we will need to take a conservative approach in administrative spending while still operating with good value, right? So are there some haircuts that we've got to take on the administrative side so that the member value, you maintain that value to your members? Increased respect for and buy-in to risk management investments. Okay, so we've talked about the challenging zone through December of 2020. We've talked about the expectable zone, right? So increasing financial constraints possibly, but also increasing camaraderie and increasing sense of coming together, probably a cadence of better and more regular communication with members as you help them. Now it's time to talk about the visionary zone. The visionary zone. So if things went surprisingly well, right? Like the federal stimulus package, maybe the second package, kind of hit the beats that it needed to hit for local governments, for your members. If your key people didn't get sick, if your key people were able to keep working, if sheltering in place worked, if flattening the curve worked, if the physical distancing measures worked, right? If that worked. If the economic tools for recovery that have been planned for local business and therefore would help local government, if those actually worked, right? So let's talk about this zone of high aspiration. And again, these could be things that happen to us, the right kind of stimulus, right? Or the right kinds of remediation for things that are very worrying financially, but also how we rose to meet it. What could that look like? So by 1231, what could be true in this zone of high aspiration? Let's see it in the chat. Jennifer Hoff, pool membership grows because more folks seek the shelter of a larger risk pool, right? That could be fantastic. M. Harrison said, we've learned that we can do without, and you're going to manage business in a more streamlined and more efficient way. That's absolutely possible. More young professionals become civic-minded. Patricia Slavin says, we could really start to refocus on what matters to member and staff, that the new normal is really streamlined and focused on that member value. Katie Feitzer says, community appreciation for locally run government. Can you envision people clapping local government officials home in the same way that we're now clapping our medical personnel home on shift changes? Jim, realistic expectations of what really can be done through technology. Yeah, for those of your pools who have said, well, we have to visit with their members, we have to do these meetings in person. Well, do we, right? There could be a readjustment for what could happen there. Dr. Esquivel says the challenge will foster employee development around leadership and organizational succession. This is always true in difficult times. You really see who's got leadership competency and how you can develop that leadership and organizational capacity to adapt. Stacy C says opportunity to educate legislators. Robert Hale, all caps, spaces in between, simplicity reigns. Patricia Slavin, new structure to organizations, more telecommuting. I mean, just imagine that, right? I mean, if we could make telecommuting more possible, would you be restricted to your geography around finding talent, or could you just find the best talent wherever it lives? T. O'Neill, ability to use technology to the full, more efficient and effective overall processes, opportunities to educate legislators. We'll find that many of the ways we're doing business now can carry forward and prove to be breakthrough in efficiency. Dave B says the true value of pooling grows exponentially. All right, so what we've just learned is that the future doesn't come in one flavor, right? The future can come in many plausible flavors, right? So if you thought about this spectrum that you're seeing on your screen, the blue spectrum, the green spectrum, the yellow spectrum, and if you were going to number it 1 through 9, so imagine that in the blue zone, number 1 was at the very bottom of the blue zone, then number 2, then number 3. In the green zone, zone 4, 5, 6. In the yellow zone, zone 7, 8, 9. Imagine that. Now, I want you to point. Think about this. Your pool, which zone, 1 through 9, right? Which zone, approximately where do you think your pool will be on 12/31? Just point to it on the screen. Are you going to be in the zone of growing desperation there in blue? Are you going to be in the expectable zone? Are you going to be in the visionary zone? Now, let's talk about how we move your finger up from wherever it was pointing to maybe just 1 degree up, 1 degree up. So how do we move you from where you expect to be based on today to where we could be if we were a little more proactive, if we took a little more ambitious approach to our future? Here's what the think tank said. Regardless of where you are, a few ideas. Carefully consider how to use your surplus. Right? So how do we think critically about this? And Anne, feel free to jump in on this if you feel like that some color commentary is necessary. But some of the other things are, take care of your cash to make sure that your reinsurance coverage and relationships are solid. Stay connected with your members. This is one of the things that came out again and again and again, that you want to keep in touch with your members, but you don't want to kill them with your email announcements and alerts. What is an appropriate cadence? And oh, by the way, this week's appropriate cadence may be different than next week's appropriate cadence, right? So what's happening before the apex is one thing. What's happening during the apex is another, and afterwards is another still. So don't feel like you have to lock into we're going to send something 2 times a week. You may need to start sending things more often or less often, depending on the zeitgeist of, kind of the spirit of what's happening within your organization and membership. Slow down now. It's okay to give yourself a breather on this. And then don't think that whatever today is the new normal. Depending on where you are in your curve and where your workforce and your members are with the spread of this pandemic, things are probably going to be different again next week and the week after that. So we know that nationally in the US, we've got a 2-week window. Individual results may vary state by state, county by county, locality by locality, but whatever's normal today may not be normal in the future. So the 5th question to ask is about tripwires. Now, some of you, this is like a military term, right? So like these tripwires were designed so that when somebody literally hit the wire with their foot or with their horse's foot, if you're going back to ye old war times, that wire would detonate a bomb, right? So that's what a tripwire, the military definition comes from that, tripwire. So for yourself, for your pool to be asking, what takes us from our expectable future zone into something that could be much worse or much better? Tripwires will push you into a new zone, right? And it could be negative or it could be positive. Either way, you want to identify what those are so that you can be ready to respond. So the think tank suggested these ideas, right? One of the tripwires is that you pay all the claims, take all the losses, and then you just run out of money, right? So if you start to try to throw all of your finances at the current issue, at the current claims, what does the long-term result look like for the pool, right? Well, another tripwire is when your members say, empty pockets, we can't make the contribution, right? Or we can't cover our new assessment. How can you think in advance of that? Right? Another tripwire is, holy cow, what if we absolutely embrace this new technology, taught members how to use it, right? Taught our staffs, and we can be as productive and efficient as possible. And I just want to say, a lot of people who aren't seen as essential workers, who are working remotely right now, are feeling really isolated because their managers are not reaching out to them. They are not, they're not having the daily stand-up meeting to say here's what's happening today, here's what we're thinking about. So how do we as managers set the tone for what's appropriate, set the tone for how to use these technologies in new ways? Another tripwire is that you find a way to provide services in areas where members have new expectations. So if you're the first out there, or you're the most effective out there with a new way to think about coverage or a new way to insure against potential future loss, whoa, your value to members just went through the roof because you're already designing a solution for something they're only starting to worry about. Next one here about commercial markets, right? So if commercial markets do leave the local public sector, that could be awesome for us. So that could be incredibly important. What about taking a lesson now about how to plan for disruptions so that in the future we know better how to adapt? One of my colleagues, Mark Funkhauser, former publisher of Governing Magazine and former mayor of Kansas City, and just finance whiz, just general finance whiz. On Friday, we're teaming up on a webinar, and we did our run through last Friday. We did our dress rehearsal last Friday, and one of the things he talked about was how important it is to keep track of everything local governments are spending right now. Local governments need to do that because that helps with, the federal government reimbursements, right? You've got to, even though you want to get out there and you want to, be as fast as you can with the money, you have to track every overtime hour. You have to track every dollar because it helps with the reimbursement. And Nick Kittle, who's another presenter on this webinar, he was like, oh my gosh, from an innovation perspective, tracking everything that we're doing is also really important. So it's interesting how taking very good notes of what you're doing in this moment can be the playbook for how we address future unexpected emergencies or disruptions. Now, it came through the think tank, and certainly I hope it's occurred to you that you need to be thinking about these 3 zones, not just for your pool, because that's been the domain we've been thinking about, but you also need to do them for your members, right? So what are your members' 6-month outlooks in the challenging zone, in the expectable zone, and in the zone of high aspiration, right? Second big thing that came out of this 2-track approach is you have to absolutely stay connected to your members, but that's your default mode. You know how to do that. But you also need to make sure that you've got one eye on the pool's overall health, right? So yes, we have to take care of our members, but we also have to, mind the store. So I'm gonna leave this slide up. I would love to take a few questions, or Anne, if a few questions have emerged for you, please take yourself off mute. But exploring the future in these 3 zones is a lovely way to help anticipate what's coming so that you can be agile, you can be calm, and when that future comes, which it will, you're ready. So any questions in the chat? Would love to see those now. Otherwise, Anne, let's have a little discussion.
So Rebecca, I'm actually going to have you pull back up. And before I'll take a minute at the end. I want to point folks to some resources and talk a little bit more about that think tank output. But what I'd love for you to do is maybe scroll back up to about slide 6, where you had those 5 sense-making questions to begin with. Because I think that's really something to draw back and for folks on the call to walk away with these 5 questions written down. The overall, I guess, suggestion, recommendation, idea is you get these 5 questions written down on a whiteboard, on a sheet of paper, somewhere in your office, and you revisit these 5 sense-making questions, probably right now, daily, weekly. You revisit them on your own, you revisit them with your staff, you revisit them with your board, and you're just constantly asking yourself these 5 questions over and over again so that you can really ground those decisions and the needs and begin to prioritize and assess all of the different questions that you're facing. Rebecca mentioned it earlier from that think tank exercise, and again, I'll point you to those resources in just a minute. But even over the course of 3 days, we were actively shifting, this group of pools were actively shifting things from the known column to the unknown column and rebuilding both of those lists. And if any one of us had been making a decision at that point in time on the day we made the list, it would have been the wrong decision, because within 24 hours or 36 hours, the knowns had shifted even further. So I think if you just even start that known and unknown list and you start tracking it daily, you're going to recognize maybe how much we don't know right now and how difficult it is to really point this thing in a direction just quite yet.
Yeah, and as you're saying that, there's one other note that I want to make about that, and that is to really, as leaders, watch your language. And I don't mean the normal cussing that I have come to love and appreciate about some of you. I mean the metaphors that we use. And this may be a bias on my part, but I think that if we use like wartime metaphors that are about an enemy, like an invisible enemy and whatnot, that puts us in a frame of mind that is like about hierarchy and command and control. And there's a time and place for that. But what I would say is in our environment where we're, we're very networked and we're accountable, like member A and members L are maybe nothing alike. So to think that sort of a command and control, top down, one approach is going to work for everybody, that does not feel effective to me. So as we think about how we language this stuff, this is much more about sort of being in the flow of what's happening. This is much more about agility, adaptability. This is about being member-centered. So just, I know that all of us in this, as we're trying to make sense of this, we're kind of looking for a governing metaphor. And I'll tell you, the one I'm using right now is that we're kind of flying this jet, right? And we've got to kind of take a cockpit approach, that there are a series of gauges and valves and a lot of information that we have to be willing to kind of take a look at to inform the right decision at the right time. So that's the only other thing I would add to that. Yeah, Jim Dispelder, and messaging among ourselves. Stacy C has said she'd like the presentation slides. I think this is probably a good time.
Yep, Rebecca, you want to feel bounced down to that closing slide. So let me just tell everybody what you have accessible to you right now and what we'll continue to make accessible. So this recording and the chat is being captured. We're going to post that on our site as soon as we can bundle it all up and get it out there. Hopefully yet today, if not today, for sure tomorrow. So you'll have the recording available to you. The presentation, all the presentation slides are already on the site. So if you are used to just going to our site at agrip.org, if you scroll down to the bottom right hand of the page in the news feed, the very first thing in the news feed is this COVID Resource Center. Or you can follow the link here. You'll get direct to the COVID Resource Center. The presentation slides from this deck are there already. Also there already is the think tank report. So we just convened that think tank last week. They met Wednesday, they met Friday. You have the full report available to you on the site already. That is an excellent springboard. It is not going to give you all the answers. It's not going to answer all the different knowns and unknowns for your pool, but it is a springboard for your own thinking. And you'll be able to read what about 10 or 11 other pools came up with and use that to jumpstart the conversations in your own operation. The other thing, a companion piece to that think tank report, as that think tank was going through its work and we were having these conversations, and then we were starting to have those 58 other pool conversations and hearing from all of you about the legislative changes, about the claims that are already coming in the door. We started this companion piece, and this piece, this claims considerations for pools, again, already linked on the website. You can go there right now and download it. This is going to be a living document. So we're going to refresh it on the website. If you download it to your laptop or your computer, it has a link embedded in the very first page. So every time you open it, go back to that link and it will refresh. This is a list of everything we're hearing from all of our pools about the claims situations that they are monitoring and that they are hearing. There is nothing on this document. I think it's about a 4 or 5 page document. There is nothing in this document that we have not already heard from one of you. So this is an excellent resource to be thinking about, what are the claim considerations and what should we be anticipating? And if you read that and you have another one, just send it to us by email, please. We're going to be updating that document as we go. A couple of other things on the right hand of this screen. This is how we've sorted our entire COVID resource hub. So when you go to that hub on our site, you'll see all of these different components. So you can look and see most of these sort mechanisms are pool resources, right? So we're pulling your resources, what you're sharing with members, and we're making sure that every other pool has access to that same information and can think about how they're presenting things. But there's one other important piece I want to point you to, and that is that very first header, legislation, legal, and regulatory actions. We took an unusual step and we convened a firm to monitor federal legislation that might have an impact on public entities and pools. And we've already today posted an analysis of the first 3 pieces of federal legislation that have come through and what the impact might be for pools in particular, and things that you're going to be wanting to look at both for your coverage, your claims response, and also what's happening to that elasticity in the public sector overall and what that might mean for your members. So take a look at those memos as well. It's all out there right now, and then we'll post this recording just as soon as we can get it together. So I think that is what we have. I'm not seeing any other questions right now, but you know how to find us. You know how to leave us an email or give us a phone call. Rebecca, thank you very, very much for facilitating today and for your continued good work with our pools.
Thanks for the opportunity. You guys take care of each other.
Bye, everyone.
Thank you.